I'm so excited to be here with Dr. Dan Yadegar, who is the founder and chief medical officer of Wellbel. For those of you who don't know me, I'm Rachel Blank. I'm the founder and CEO of Allara, which was started out of my own personal experience trying to manage PCOS and my hormone health journey. And so started Allara as a virtual care platform for women with hormonal health challenges, which I'm excited to connect with Dr. Dan about because I know a lot of his journey is personal as well. So Dr. Dan, why don't you, to kick things off, introduce yourself and tell us a little bit more about you?
Well, first of all, thank you for having me. I'm so excited to be on this podcast with you. My background, my name's Dan Yadegar. I'm an internal medicine doctor and a cardiologist by training. I did my undergrad at Harvard, med school at Cornell. Then I did functional medicine training. So I'm very interested in how the body operates, the relationship of food and hormones and stress, and how we can be our optimal selves. I founded Wellbel with my co-founders, two of which are my sisters, right before the pandemic, maybe a month before. And it was, one of my sisters had hair loss that was postpartum, hormonal related as well. And the other one had alopecia areata. And I looked at the supplements that were out there and the ingredients, and I wanted to create something that I thought was right for my sisters with the highest fidelity ingredients, really good outcomes with low side effects. And that's where Wellbel was born. And now I'm one of the co-founders and the chief medical officer.
Amazing. Could you tell us a little bit more about kind of the beginning of Wellbel? I know, it sounds like it's very much a personal family mission, but what was that process like of getting things off the ground, and how did you figure out the right kind of supplement?
Gosh, that's a great question. Having done a functional medicine fellowship, I think in the back of my mind, I always sort of fantasized about like playing with ingredients and how they would come together. But it didn't really become necessity until my sisters went through their own hair loss journey. And me and my sisters, we have a very close family unit. And at first, we sort of got these unmarked white bottles from the manufacturer, and they tried it. And a couple months later, we were at a sushi restaurant in New York City, and they're like, Dan, you won't believe this. Like, I have like baby hair growing in. And then we tried it on a few other people, and it worked really well with really no side effects. And then we sort of went to market from there. And we've really grown organically through our community, through people who've believed in us.
Yeah, that's amazing. I think that's actually how I originally found out about Wellbel, was an influencer who just loved it and started talking about it. I think was an advisor with you guys.
Yes.
So yeah, it seems like it has this very organic word of mouth traction, which is awesome.
Thank you.
Can you tell us a little bit more? I think one key benefit here is that you are a doctor, and it does have, the medical and science backing to it. Can you tell us a little bit more about the science behind the supplements and some of the ingredients?
Absolutely. So my first day of medical school, when you get your white coat at the white coat ceremony, you take the Hippocratic Oath. And the thing that you promise is, first, do no harm. So in putting together this formulation, I wanted something that was effective, evidence supported, that wouldn't really have a lot of side effects. Now, if you look at the competitors, some of them have really high doses of biotin. Biotin can cause biotin overload, which can cause you to be vitamin B5 deficient, develop acne, nausea, abdominal pain, and more frighteningly, it can interfere with different important lab assays like thyroid function and cardiac troponin levels. So I really scoured through the literature. I did my own literature search on PubMed and looked at different ingredients and thought about the right dosage and the right combinations and played around it. And I thought to myself, I want to create a formulation that sort of approaches hair loss across different pathways. So sort of looks at inflammation, blocks the conversion of testosterone to DHT, creates the precursors for elastin and keratin. So it's a very holistic, multi-pronged approach. So it's after a careful literature search, putting my nerd cap on, really going through the literature and distilling it to the best ingredients that are gluten-free, non-GMO, no artificial fillers, vegan, that Wellbel was originally born. So it was a lot of passion, went into it.
Yeah, I think that's such an important point that a lot of us miss is that kind of interaction on supplements on the rest of your health and how it can affect lab values or other things. I think sometimes we just think like, oh, it's a supplement, so it's
Yeah.
different than a medication. But I think that's a really good point that we should be thinking about.
And to your point, I mean, I'm involved with biotech and I see the FDA regulatory process, which is so careful about side effects. Supplements are not regulated. So, I think Wellbel having me as a medical director sort of thinking about the safety, efficacy, and not only that, if you take something and you don't tolerate it well, you're not going to be compliant with it.
Right.
So in terms of long-term compliance, I wanted to create something that people were like, I can be on it. It's going to have health benefits above and beyond just hair loss. And I'm going to tolerate it well.
Yeah, I think that's great. So at Allara, we specialize in patients with hormonal health conditions like polycystic ovary syndrome or hypothyroidism or other kind of hormonal imbalances. And I know a lot of our patients, including myself, have a lot of issues with just hair in general, right?
Yes.
Like you might have too much hair on your face, you might have too little on your head. What's some of your advice for patients struggling with hormonal imbalances that affect their hair? What are some things that we can be doing to improve that?
That's a fabulous question. So for women, hormonal imbalances can happen as early as preteen, when you first get your menses in terms of PCOS and androgen excess, and then go all the way into perimenopause and beyond. And it depends on what the hormonal imbalance is. Hormones play a really important role with hair. So whether you're talking about androgen excess, whether you're talking about hypothyroidism, whether you're talking about too much cortisol and stress hormones, all of those things can play a role in the amount of hair, the quality of hair, the shedding of hair. So I think the first thing is to truly figure out where are you on that spectrum. Do you have PCOS? Are you on the spectrum? In terms of your thyroid, are you hyperthyroid? Are you euthyroid, which means normal, or hyperthyroid? And then it gets even more nuanced beyond that. You can check cortisol levels. And in some patients, I even check micronutrient levels. I had a woman who's postmenopausal, hair shedding no matter what she did, and we did a special micronutrient test and she was zinc deficient. Meaning had I not figured out that she was zinc deficient, it would have just been chasing my tail.
Yeah.
Put her on zinc and the shedding stopped. So it's a bit of detective work.
Yeah. And I'm curious, zooming out maybe a little bit from that, I think one thing a lot of patients struggle with and something I struggle with myself is it can be hard to find a place where you're getting like medical expertise and more of this kind of holistic and lifestyle type medicine, like kind of like what you were talking about, especially for somebody who might not have access to somebody like you. What are some kind of general lifestyle management tips you might have for somebody struggling with a hormonal imbalance?
I would say there's some really basic things, when it comes to having a good wake-sleep cycle. A lot of your hormones are regulated by your circadian rhythm. So just getting educated on what having a good wake-sleep cycle looks like, managing stress. I do believe cortisol and stress plays a really big role. So putting into place some mindfulness practice and learning how to do that is incredibly important. And then if you do struggle with whether it's PCOS or climacteric symptoms of perimenopause and menopause, there's books, there's articles, there's blogs, just educating yourself on that and figuring out what you can do from a nutritional standpoint, from a supplement standpoint to help balance that. For instance, in Wellbel, the Women's Plus, which is for peri and postmenopause, we have additional saw palmetto to sort of balance the testosterone and zinc. Both of those things are important, both for women who are PCOS and who are peri and postmenopause, because both of those states share something in common. There's androgen excess. There's too much testosterone. And when that testosterone gets converted to DHT, the evil cousin of testosterone, that's when miniaturization of hair follicles happen. So those two populations, even though they're different ages, need additional hormonal support.
Yep, that makes a lot of sense. And do you have on your website, I assume, like you have kind of, if I know I have hypothyroidism or I know I have PCOS, it'll kind of help me figure out which supplement is the right supplement
Right.
for me to take?
Yes.
Okay,
Yes, it does.
that's great.
Yeah.
Do you have any success stories you can share, maybe either from your practice or
Oh
from
my
a Wellbel
gosh.
customer?
I wouldn't even know where to start. I guess I'll start with my sisters because
Yeah.
they were the original success stories. So my sister Dahlia, who's one of the co-founders, was pregnant with twins. And 9 months after she gave birth, she started having postpartum hair loss. That was a tremendous success story, as was my other sister. And hair loss really affects people at a very vulnerable place of self-confidence. How do you fit into society in terms of going to the workforce or dating or being with your friends? And we've had patients who've had hair loss from chemotherapy, hereditary androgenetic hair loss, hormone-related or autoimmune-related hair loss, and just getting on those Zooms with those patients. We had one patient from Panama who got bullied her whole life for having thin hair and not having hair. And we got emotional on the Zoom, knowing that Wellbel gave her this sense of agency, this sense of self-confidence. So many success stories. It's really the best part of being a founder of Wellbel is really connecting with the community and hearing how it affects self-confidence.
Yeah, no, I totally relate to that. I always say the best part of my job is hearing from patients. Like the best thing ever is when we hear there's an Allara patient who gets pregnant who wanted to. Like the whole team gets a Slack about it.
It's such a
and we get
success
so
story.
excited. It's so exciting.
I know, it's so validating.
Yeah,
Yeah.
it's amazing.
Yeah.
I know we've talked a lot about, supplements aren't FDA regulated. It can be hard to know what to trust. If you're a consumer out there, obviously, other than trusting the Wellbel brand, what are some things you might look for as a consumer in supplements you're purchasing to help understand that you can trust them? And what are some things you've done at Wellbel to help consumers be able to trust your supplements?
Those are such great questions. I think answering the first question, in general, if a supplement has like 30 different ingredients, I tend to be a little bit more cautious because it's very hard to know how all of those ingredients are going to interact with each other. So the first thing is just looking at the ingredient list and looking at the number of ingredients. Second thing might be to see if the company has any educational material about the supplements. And if there's any questions, running it by your primary care physician. So, as supplement companies, you and I can't really give medical advice, but we certainly can recommend that people talk to their gynecologist or their internist to see if this supplement is right for them, if it interacts with any of the medications that they might be taking. In terms of Wellbel, sort of laddering up to that number of ingredients, we kept our ingredient list really concise. I spent a lot of time sort of perfecting the number of ingredients and the dosages and the combinations. So just being a physician and having that insight sort of, I think gives our customers a certain sense of confidence in our product. And we're always there to support them if they have any questions.
Yeah, I think that's such a good point, both making sure that the supplement itself kind of has some sort of scientific or doctor input to it, but also such a good reminder that you can and should be asking your own providers about your supplements. And I know that's something that our medical providers talk to our patients about a lot at Allara is supplementation and how do we think about that interacting with your medication?
100%.
How do we use your labs to help you figure out what works?
Because now we live in a day of precision medicine. You're different from me. I'm different from my sister. Everyone has different, past medical history, medications, allergies, food allergies, medication allergies. So it's one size fits one.
Yep.
That one size fits one practice of medicine. So I do encourage people to have these discussions with their primary care physicians.
Yeah, I love that. I always say it's so important to just get your blood work done because it can tell you so many things that otherwise you're just kind of flying blind on things. So I know Dr. Dan and I talked a little bit about this before we started recording, but I think this question maybe affects a number of people, but I'm getting married next year.
Congratulations.
And of course, I am starting to think about how do I have my hair looking as good as possible about a year from now. If somebody, is like me and they're like, okay, I have something coming up, I want my hair to look great. What is some advice that you have for them?
So Wellbel would be, a huge part of that. And I'll go through some of the ingredients. So saw palmetto's in there that blocks DHT formation. That boosts your hair. It has betaine hydrochloride, which increases your stomach acidity just enough to break down food better. So you're absorbing your amino acids and your micronutrients. It has MSM, which is a natural anti-inflammatory. It provides the disulfide bonds you need for healthy hair, and it gives you the precursors for keratin and elastin. And it also has a physiologic dose of biotin. And I think those are the hero ingredients. I think in addition to that, just self-care, making sure that you're exercising. Again, growth hormone is super important for hair health. And most of your growth hormone, 75% of growth hormone gets made in stages 3 and 4 of sleep. So getting good restorative sleep. And it just comes down to being kind to yourself and making good decisions around, diet, exercise, sleep, lifestyle, stress. All those things really ladder up.
Yeah, awesome. I was just saying I'm like ordering Wellbel as soon as we finish. Kind of as we wrap things up, maybe what is one piece of advice that you wish every woman knew when it comes to either her hair health or her overall hormone health?
Be curious, ask questions, interact with your providers, with your internist, gynecologist, and know your data, know your body, and feel comfortable asking questions if something doesn't feel right, whether it's about your cycle, whether it's about certain symptoms, weight gain, weight loss. Be your own advocate, educate yourself, find the right resources to do that, and get your labs, as you said. Get baseline labs so that you have insights and you can make decisions that are based on data and information.
Yep. Great advice.
Yeah.
Awesome. Well, thank you so much.
Thank you so much for having me. Congratulations again on your wedding.
Thank you. And you too on all the success. Like I said, I am ordering Wellbel right after this call. Awesome.
Thank you. Thank you very much.
I feel like part of it is, I don't know if you think this, I feel like we've just shoved everything into the OBGYN and been like, it's a woman. Like, you deal with all of it. And we don't really do that in other things in medicine.
Yes.
Right? So as an OBGYN, how are you supposed to know?
And they don't know. I mean, their answer to everything is put them on birth control.
Yeah.
It's like the answer to everything.
Right. Yes. Which can be great. It's just
It's just not always the right answer.
Yes.
You really have to, it's nuance. And female hormones, male hormones are so easy to deal with. So if I have a patient with hypogonadism and they need testosterone, it is just so easy. Female hormones are much more complicated. And it's also depends on where you are in, are you 18 or are you 60? Do you have a BRCA gene mutation in your family? Do you not have a BRCA gene mutation? There's a lot of information to collect and act on, which I think actually makes it a lot more interesting.
Yeah.